But without further ado, I would love to introduce and have the honor of introducing the heart of SA Drug Policy Week, Shaun Shelly.
Okay. Good evening and welcome to SA Drug Policy Week 2018. I thought this was supposed to get easier, but it doesn't. Last night I made a momentous decision in my life. At about 11 o'clock, with a list of about 7 essential items to deliver, one due to our COO, I decided rather to go to sleep. For me, that is rather a difficult situation. But I did it. And you know what? The sky didn't fall down, the world didn't collapse. And that's because I've got really good support in TB HIV care. I'm not going to thank everybody now for that, simply because it would be kind of, I don't know, like perhaps predicting that something might go wrong. So I'd rather not do that. I'll leave it till the end of the week. Michael, thank you very much for your speech. I know that you've got an important engagement, so if you want to leave, you're more than welcome, but thank you so much for your speech. And we really appreciate you being here and making the effort to be here, despite your very tight schedule. So I really appreciate that. Thank you very much. So once again, the aim of SA Drug Policy Week is to bring the most important drug policy stakeholders into the room and have an exchange of ideas with both local and international experts. And we bring together experts from the criminal justice sector, the health sector, and of course we bring together that group that stand to lose or gain the most from these discussions, people who use drugs themselves. And that's a population that I identify with. I'm part of that key population. And we are here to disrupt some of the narratives that you hear about drug use, but also be very aware of the tremendous amount of harm that's happened in the name of drugs, but also the drug war in South Africa and to a lot of our populations. And one of our goals is, if we don't get the right people in the room, we want people to say, I should have been here. And certainly, we have achieved that. I've got letters to prove that people from all corners of the globe applied to be here. We had lawyers from Nepal. We had people from countries that I haven't even heard of, quite frankly. And then we had one Australian who managed to slip in. And so I'd like to welcome Jeff Howard from the Parliament of Victoria. That's not the Victorian Parliament, because even though some of our drug laws might look Victorian, he's from the state of Victoria. So thank you very much for making the trip to come here, and we hope to learn something from you as well. Thank you. So the first SA Drug Policy Week was called Run 2016, and that happened in 2016, ahead of the UNGAS, or the United Nations General Assembly Special Session on Drugs. And there was an air of anticipation. This was the first time that the conventions were going to be challenged, and everybody was talking about these huge changes that were going to take place. And we should have listened to the keynote speaker then, Julian Buchanan, who said, I think you are naively optimistic. Of course, we said this after UNODC had released, not released a decriminalization position, but that wasn't an official paper, it was withdrawn, but then reintroduced very softly at a later stage. But essentially the message from the UNODC is this is a human rights issue. This is not a criminal justice issue. And so we thank the UNODC for continuing to support this week. We really do appreciate it. And thank you very much for being here. And I look forward to working with you as I look forward to I enjoyed working with Jason when he was here. Thank you so much. So that was the first SA Drug Policy Week. And the other thing that was important was at that stage, we just started seeing what harm reduction meant. We had the very early stages of the first needle and syringe programs, and we had no OST at that stage. We had a meeting, Professor Marks was there, some people from National Department of Health, a few others, to discuss the possibility of having South Africa's first opioid agonist treatment program, maintenance program, should I say. And then a series of fortuitous events. Thank you, Myrtle, and Jules, for your contribution to that in bringing Professor David Nutt to South Africa. This list of fortuitous events meant that we had one of the finest groups of speakers that you could possibly get in a drug reform setting. And that's not taking anything away from this year's speakers, obviously. But we had Ethan Nadelman, Professor David Nutt, Neil Woods, who wrote his book, Good Cop, Bad War. And I'm pleased to say that he's written a new book, which is actually even better than that book. And I've got 2 copies to give away later in the week. We'll tell you about that. Neil sends his apologies. We were hoping to get him here, but he was unable to make it due to other commitments. And then, of course, we had the great legal mind, Anand Grover, who is one of the commissioners on the Global Commission on Drug Policy, who have been very supportive of change in this country. We certainly lived up to our slogan, "We need to talk about drugs." And SA Drug Policy Week 27 sparked lively debate, not only in South Africa, but regionally and globally. And so we arrive at SA Drug Policy 2018 with a very sort of different South African setting when it comes to drugs and the way in which we respond to drugs. In 2017, TB-HIV Care and the Urban Future Center implemented the first low-threshold opioid substitution or opioid agonist therapy program that we'd first spoken about at the Run 2016 event. We then had the entry of the Global Fund through Right to Care as a principal recipient and TB-HIV Care and Nova Health as sub-recipients. And we saw services and awareness of harm reduction expand. Then the city of Tshwane really stepped up to the plate because the city of Tshwane were the first city in South Africa to start funding needle and syringe programs and opioid agonist therapy. And they have over 700 people on opioid agonist therapy now. And this is a tremendous example of how we can sustain these kinds of programs and integrate them as part of our public well-being and our public health system. And I think there's a lot that we need to learn from the City of Tshwane's approach, which was implemented at a time when this kind of approach was not very popular. But people are going to be saying, they were the leaders, why aren't we doing it? And the city of eThekwini, or the municipality of eThekwini, should take an example or look at the city of Tshwane as an example, I believe. So the community-oriented substance use program in the city of Tshwane is implemented by the University of Pretoria, and that's my other boss, Professor Yanni Hugo, who's here today, and thank you very much for being here. Of course, my other boss is Professor Harry Hausler, and thank you, Harry, for your introduction again, and Gareth as well, who's also my boss. I've got a lot of bosses. And yet, I think that I answer to nobody, but of course I do. So we've seen how Tshwane can do it, and more recently we've seen the Constitutional Court decriminalize effectively the use of cannabis in private spaces. Whether or not one supports this decision, it will certainly create a much-needed momentum around the debate of drug policy and the change of the drug policy landscape locally and internationally, which is changing rapidly. However, not all is progressive and evidence-based in South Africa. While the city of Tshwane were looking towards science and compassion for new ways to reduce the impact of drug use in the city of eThekwini was moving backwards. Despite engagements over a period of 36 months and with assurances that the provision of sterile injecting equipment by the Step Up project was compliant with regulation, the Deputy Mayor chose to close down the program, leaving people who inject drugs increasingly vulnerable to HIV, hepatitis, sepsis, endocarditis, and ultimately early death. There is still a reluctance to accept harm reduction services, not only among the general population, but also among some medical practitioners. This is unconscionable. The evidence is clear. We are still awaiting South Africa's new National Drug Master Plan. We know that there are some delays, and early draft versions of the document, and thank you, David, for presenting today. It was a really great presentation. As David said, early drafts of this document showed a lot of promise, yet it remains caught within the bureaucracy of the National Department for Social Development. There are further challenges. South Africa still pays up to 30 times more for methadone than the Ukraine does, for example. 30 times more for a drug that's been around for 40 years. Methadone is still not on the essential drug list for long-term opioid agonist therapy. The latest cures for hepatitis C are not available in South Africa. Because to register any new medication, no matter how effective it is, it takes up to 36 months. There are continued assaults on people who use drugs. I got a report yesterday of a number of assaults in Johannesburg and the Hillbrow area of people who use drugs. We had one of our service beneficiaries slaughtered the other day just because he uses drugs, for no other reason. And of course, in the Constitutional Court judgment, Judge Zondo framed the use of cannabis as a great social evil. Yet not once did he refer to the evil of the racist origins of prohibition or the evil of the disproportionate punishment for those using cannabis, particularly from the marginalized communities that we see every single day. Young children criminalized and gangsterized. We also need to consider the many people who do not have private spaces to live their lives and maybe look at the impact of that on driving the dependent use of drugs. At the South African Drug Policy Week 2018, we will examine many of these issues through the critical lens, keeping in mind the international, regional, and local data and the emerging evidence from innovative programs and the local context. We aim to focus this year on African and South African interventions and these new innovative interventions that we've got, innovative certainly for our setting. And we are no longer being passive, we are doing, and we are finding new approaches and paths towards effective drug policy and interventions that focus not only on the individual, but also the context and the systemic drivers that make the use of drugs more harmful than it need be, yet still so meaningful. For many, the risks are indeed worth it. SA Drug Policy Week would like to thank TB HIV Care, Open Societies Foundations, Right to Care, and the Global Fund for the resources and the funding that make this event possible. People have had to put up with me bugging them all the time. Right to Care, we're waiting for some paperwork to come through, and I phoned them every single day. And Ian got a number of, all the Ians got a number of emails from me on a regular basis. And some people even wondered whether it was happening because I tended to operate in a bit of a vacuum at times and then sort of dump things upon them at the last minute. So thank you for indulging me, thank you for being there, and thank you for supporting this week. SA Drug Policy Week, I believe, is going to be of great benefit to you. I trust you'll benefit from the experience and that you'll think critically about drug policy and our global, regional, national, and most importantly, our personal responses to drugs and the people who use them. And it now gives me great pleasure to introduce our first keynote speaker. Last year, we closed with the commissioner from the Global Commission on Drug Policy, and this year, we'll start with one. This will be the third commissioner from the Global Commission I've had the privilege of introducing to a South African audience. 3 years ago, it was Madame Ruth Dreyfus, the former president of Switzerland, and a great advocate for drug policy reform. And she spoke to an audience about opioid substitution therapy in a South Africa where there was no opioid substitution therapy. Last year we had Commissioner Anant Grover, who spoke of the legal arguments that he believed would secure a constitutional court decision that would decriminalize the use of cannabis in private space. He was correct. And the court has ruled that the use of cannabis in private space cannot be made a criminal act. And indeed, we now have opioid substitution therapy in the country. So, following from these two events, I'm looking forward to what Commissioner Michael Kazashkin has to say today, because there seems to be a pattern. A commissioner from the Global Commission says it, and it manifests. If this proves to be true, I would not be surprised. Each of the commissioners of the Global Commission on Drug Policy is a person that has earned respect, a person whom global leaders and policymakers will listen to and take seriously. And Professor Kazashkin is no exception. I first heard him speak at Wilton Park in the UK at a hepatitis C meeting, and I said to myself, I would like Michelle to be at SA Drug Policy Week, because he speaks with an authority that means that he doesn't have to compromise what he's saying at all, with a calmness and with an absolute assuredness that is supported by ample data. And so I'm really looking forward to this talk. These achievements that of Michel's, which are huge. You can go and look on his website. It's just pages of things that he's achieved. I wouldn't possibly be able to do it justice. But what these achievements have meant, that it's led him here today to share his wealth of knowledge with us. And if we can just take on a small portion of that knowledge, we would have a much better South Africa. A South Africa where our youth have hope, have opportunity, and will find that the use of drugs is not the most important thing in their life. And so it gives me great pleasure to introduce Commissioner Michel Kazaksin.